The CDC's director, Dr. Malaria, a disease for third world countries, faraway places? Not so. Cases of malaria are the highest they've been in the United States in more than 40 years. The most recent news from the Centers for Disease Control reports malaria cases have gone up. 1,925 cases in 2011, a 14% increase from the year before. Should we all be concerned with the potential epidemic?
What's wrong with Serena? Serena was on vacation in Africa. However, she has been having a lot of muscle aches and is constantly vomiting and tired. When looking at her arms and legs, she has been found with a lot of mosquito bites. If you guessed malaria, that is correct. Hello everyone, my name is Shelly and today I'll be presenting some information about the bloodiest disease, aka malaria. Before we move on to talking about the disease and the causative agent itself, I want to briefly go over the history of malaria as a disease. So the causative agents for malaria are believed to have developed in the tropical and humid environment of Africa anywhere from 2.5 to 30 million years ago. Malaria as a disease has been infecting humans since the ancient Greece, Roman, and Egypt periods. Some famous victims of malaria include Alexander the Great and Charles V. It was named malaria, meaning bad air, due to the Roman belief that it was attributed to things in the air. It wasn't until the 1870s that mosquitoes were attributed as the transmitters for this disease. Here's just an overview of the presentation for today. We'll first go over some basic information on the disease and its causative agent. Then we'll talk about how it can be diagnosed and what its infection stage looks like, as well as what makes malaria's microbes so virulent. Next, we'll go over some methods to prevent malaria and some methods of treatment for when one is infected with malaria. So let's start with the basic information about malaria. We'll go over the causative agent, where its areas of infection in the human body are, as well as the epidemiology of the disease. There are a couple causative agents for malaria, but the main and most prevalent one is Plasmodium falciparum, which is the one that we'll be focusing on today. The microbe itself is a crescent or sausage-shaped microbe, which you can see in this image right here in the top right corner. And they are neutrophiles as well as microaerophiles, meaning that they multiply best at a neutral pH and can only survive with low concentrations of oxygen. Lastly, they are also mesophiles, meaning that they grow best in moderate temperatures that are neither too hot nor too cold, and their optimum growth temperature varies from 20 degrees Celsius to 45 degrees Celsius. So it is not surprising that they infect humans whose body temperatures are 37 degrees Celsius typically. The microbe itself is a protist from the domain Eukarya and kingdom Protista. To grow them in a lab, a complex, enriched media is needed. There should be growth factors such as blood and serum present in the media as well. Although the human body has its fair share of microbes, Plasmodium falciparum is not a part of the normal flora. Therefore, when one gets infected with this microbe, the lymphatic, digestive, respiratory, immune, nervous, and urinary systems are all affected. In terms of epidemiology, malaria is classified as an endemic in certain countries. However, there have been epidemics of malaria before, and the disease itself is considered an acute febrile infection. It is most common in warmer areas of the world, such as in tropical and subtropical countries, and can mostly be found in Africa, South America, Central America, etc. Talking about numbers, malaria has a morbidity of approximately 241 million cases in 2020, a mortality of approximately 627,000 cases in 2020, a prevalence of approximately 247 million cases in 2021, and a 5% global increase in incidence from 2019 to 2020. Moving on to the diagnosis and infection process of malaria, the most common symptoms of infection are shaking chills, muscle aches, headaches, nausea and fatigue, vomiting and diarrhea, as well as rapid heart rate and breathing. Although this is not common or typical, there is possibility of anemia or jaundice. Now, there are a couple ways to diagnose or detect malaria in patients. One way is through microscopic examination of the presence of the microbe in blood smears, and another method is through rapid antigen tests. As of right now, only Binax Now is approved for use in the US. The last method is by molecular analysis, where we're detecting the parasite's nucleic acid using polymerase chain reaction, also known as PCR. In terms of the disease itself, the incubation period in most cases varies anywhere from 7 to 30 days and is transferred through vectors such as human, Anopheles, mosquitoes, as well as through vertical transmission, for example, from a mother to their child, just regular contact, or even just through the air. Reservoirs for the microbe typically include humans and Anopheles mosquitoes, which is why the disease is so common in tropical and subtropical countries. The microbe typically enters the host through the mouth or a syringe, and once the damage has been done, the microbe leaves the host either to infect another host or just to exit the host through openings or cuts in the skin or the placenta. So now let's answer the question of what makes malaria so infectious. To answer the question, let's go over some of the virulence factors of the microbe. First, the microbe has the ability to modify the surface of the red blood cells that it infects. It also has antigenic variation, rhabdoids, and a subcellular organelle by the name of a picoplast. Okay, now that we've covered the severity of malaria, we obviously would want to prevent it. So let's briefly go over how to prevent even getting malaria in the first place. There are two basic categories of prevention. The first category is just to avoid mosquitoes, which are malaria's biggest transmitter. To avoid these infectious mosquitoes, one can use an EPA-approved insect repellent, use a mosquito net while sleeping, and just overall keep mosquitoes out of the living space. The other category is to limit skin openings. One can wear long sleeves and long pants, use permethrin, which is a type of insect repellent, on clothes, nets, items, etc., as well as just close the windows and prevent any chances to let the mosquitoes get to your skin. Now, I don't want to be negative, but let's say the prevention methods didn't work and one is infected with malaria. Luckily, there are some ways to treat it. Before I mention the treatments for malaria, I do want to mention some of the regulations of malaria treatment. Malaria treatment is dependent on the species of the Plasmodium microbe, the clinical condition of the patient, the expected drug susceptibility of the infecting parasite, and any previous malarial drug use of the patient. Okay, now that the regulations are out of the way, let's talk about the treatment methods. The first method of treatment is antimalarial drugs. The first one is called chloroquine. Chloroquine is the preferred method of treatment for any parasite that is sensitive to the drug. Unfortunately, however, in many parts of the world, parasites are resistant to chloroquine, and the drug is no longer an effective treatment. Luckily, there is a backup plan, a plan B. The plan B is called artemisinin-based combination therapies, or ACT for short. ACT is a combination of two or more drugs that work against the malaria parasite in different ways. This is usually the preferred method of treatment for chloroquine-resistant malaria. Examples include artemether lumefantrine and artesunate methylquine. And if the case of the patient is severe, intravenous artesunate may be performed. In addition, as a more preventative measure for not getting malaria, there is an approved vaccine. However, recent studies have proved that an effective and improved vaccine from the first approved vaccine has been created, called the PFSPZ vaccine. It's created by a Maryland-based Scenaria Inc. called Rockville using a live causative agent. Its efficacy lasted for 8 to 14 months in previously infected African adults. It is also important to note that malaria, though it is possible to treat and cure completely using the correct drugs, may be a difficult disease to control due to the highly adaptable nature of the microbe as well as its vectors. That is it for the presentation on malaria for today. Thank you for listening, and I hope you learned something about malaria. And if you know anyone who's like Serena, who's exhibiting the same symptoms in the same situation and feeling the same way, please let them watch this presentation to let them know what they're dealing with, as well as their possible ways of treatment and ways to prevent the same thing from happening to them again or to the people around them.